Welcome, everyone. My name is Joanna Cohn. I'm director of the Institute for Global Tobacco Control at the Johns Hopkins Bloomberg School of Public Health. And I want to welcome you to our Innovations in Tobacco Control lecture series. And I am so delighted to be able to introduce our speaker today, Dr. Connie Hoe. Dr. Hoe is on faculty at the Bloomberg School of Public Health, and she's also the research group lead and the Alexander von Humboldt Research Fellow at the Heidelberg Institute of Global Health at Heidelberg University in Germany. Her research focuses on the politics of health policymaking, particularly in low and middle income countries. And she uses social science theories and methods to explore the processes and determinants that lead to public health policy adoption, policy implementation, and compliance with policies. So for example, this includes understanding the role of interest groups, including corporate actors, as well as other actors in the policymaking process. So Connie's, critical research focuses on the strategies and tactics and even arguments sometimes that are used by corporate actors. And all this can help inform policies that maximize the public's health. Dr. Hoe received her PhD from Johns Hopkins Bloomberg School of Public Health, her Master's of Social Work from the University of Pennsylvania in the School of Social Policy and Practice, and her undergraduate degree was at Johns Hopkins University. So really looking forward to Dr. Hoe's presentation on strategies to expand corporate autonomy, looking at multiple industries today. So Connie, welcome, and over to you.
Thank you so much, Joanna, for the kind introduction and the warm welcome. Really delighted to be here today to tell you a bit about my work. I'm just going to share my screen now, and give me 1 second. I hope you guys can all see my slides. Maybe let me know.
Looks great.
Wonderful. Okay. And I promise the yellow subtitles at the bottom will fade away very, very quickly. Okay, so the title of my talk today is Strategies to Expand Corporate Autonomy by the Tobacco, Alcohol, and Sugar-Sweetened Beverage Industries. And so this study was undertaken with my co-authors listed here to really explore the strategies used by these three industries. So I'm going to start with a bit of background, provide some definitions, and then I'm going to tell you about our study objective, the methods that we use to answer our study questions, our results, and then I'll end with some discussions. Okay, so let's start with background. I think I will start with some definitions, and the first one is on commercial determinants of health. So there's many definitions out there to define commercial determinants of health. One of the most popular one that's been used is defines commercial determinants of health as strategies and approaches used by the private sector to promote products and choices that are detrimental to health. And so in recent years, concerns about commercial determinants of health have been increasing within the public health community. And this is due to the fact that corporations are becoming more and more autonomous as a result of rising demand, increasing market coverage, and also the continued internationalization of trade. And so the global expansion of corporate autonomy compromises, unfortunately, government's capacity to promote equality as well as public health. So now let me define what I mean by corporate autonomy. So corporate autonomy can be defined as the ability of corporations to establish its internal and external decision rules, its freedom to act according to its own rules, and its power to sanction nonconformist behavior in the sphere of influence. So in other words, what I mean by this is that it allows corporation the freedom to prioritize their own interests, and oftentimes that is at the expense of public interests, including public health. And so, as you know, few private corporations actually enjoy full autonomy, but corporations have been persistent in their attempts to expand autonomy by preempting as well as resisting control. And so corporate autonomy can really be considered one of the drivers of ill health that's influenced by and also influencing the practices of corporations. Now, non-communicable diseases, as many of you know, these are major public health problems. 70% of global deaths are as a result of NCDs. And the majority of them occur in LMICs, low and middle income countries. So most recently, the WHO uses this 5x5 table, as you can see on your left-hand side, showing that the 5 NCD diseases are cardiovascular diseases, chronic respiratory diseases, cancer, diabetes, and mental and neurological conditions. The 5 risk factors are unhealthy diet, tobacco use, harmful use of alcohol, physical inactivity, and air pollution. And so also according to WHO, tobacco use, alcohol use, and consumption of unhealthy diets are key risk factors that contributed 2/3 of NCDs. So traditionally, the way in which we have addressed these NCDs was focusing on modifying individual level behavior because they were considered lifestyle related diseases. But today there is a growing recognition that key drivers of the NCD epidemic also includes commercial determinants of health, including the policies and practices of transnational corporations that promote unhealthy commodities, namely tobacco, alcohol, ultra-processed food and drink industries. So these transnational corporations are politically and economically influential. And there's a lot of evidence out there to show that they use an array of tactics to influence the social and political environment, which then shapes the lifestyle and choices of consumers that ultimately influence health outcomes. But now there are many gaps in literature remaining. One is that even though there's this renewed attention on this topic, most of the existing work has been focused on the policies and practices of single industries that negatively impact health. So for example, looking at the strategies of the tobacco industry and its influence on health, or looking at alcohol industry and the strategies they use. So very few, although very notable exceptions exist. Very few studies have sought to systematically synthesize the existing evidence across the 3 industries and to compare and contrast the strategies that are used. And so in light of this gap, we've decided to conduct this study, and our primary objectives are to answer the following 2 questions. Is there an emergent taxonomy of strategies used by the tobacco, alcohol, and sugar-sweetened beverage industries? So I'm just going to refer to it as SSB now for short, to expand corporate autonomy. And then secondly, how are these strategies similar and how are they different? Okay, so now I'm going to move on to methods. All right, so in order to answer these study questions, we conducted a scoping review. I'm sure many of you are familiar with what scoping review is, but just to make sure we're all on the same page, a scoping review really is a type of research synthesis that aims to map literature on a particular topic or research area, and it provides an opportunity for us to identify key concepts as well as gaps in research and the types and sources of evidence. And so we carried out this scoping review under the guidance of a framework which helped us identify the specific steps that we need to take. So this framework was developed by ARC-C and O'Malley. And the first step was to identify our research question, then to identify relevant studies, Then we select our study, we chart the data, and then we collate, summarize, and report the results. And our guiding question, so the first step, which is the same as our study objective, the scoping, the two questions were, is there an emergent taxonomy of strategies used by the tobacco, alcohol, and SSB industries to expand corporate autonomy? And how are these strategies similar and how are they different? Okay, so let me provide a few more definitions. So by industry, our research team defines it as multinational, transnational corporations involved in the production, distribution, and marketing of tobacco, alcohol, and or SSB products, as well as those supported by these corporations to maximize sales of their products. And then by strategies, we actually defined it quite broadly to mean corporate practices, the business and political activities of corporations aimed at promoting corporate autonomy. Okay, so then we had to develop our search terms, and we consulted our university librarian on this, and we organized our search terms around 4 key concepts. So the first was tobacco, alcohol, SSB. The second was corporation. The third, tactics. And the fourth related to methodology, which I'll tell you a bit more later. And this was review and qualitative synthesis. So this is an example of the search terms we used for the 4 key concepts for the database PubMed. Okay, and using the search terms, we searched 6 different databases in June 2021. So PubMed, Scopus, Embase, Web of Science, Business Source Ultimate, and EconLit. And we use Covidence, which is a web-based software to help us manage the study selection and evaluation. And here is our flow chart. And so using the search term, searching the 6 databases that yielded over 10,000 articles. After we removed the duplicates, we got about 6,000 left over. And then we screen these articles based on our inclusion-exclusion criteria. So let me just jump to that slide to explain. So for an article to be included in the study, it must be published in a peer-reviewed journal from 1984 to June 2021. So we didn't set a time limit, basically. It must be published in English. So we excluded articles that were not in English. And it must be a review article aimed at synthesizing evidence from at least one of the 3 industries. So we defined review article based on Grant and Booth's article on the typology of reviews. And the reason for including review articles only is to ensure that the number of articles that we review is manageable. And I'll tell you a bit more about that in our limitations as well. Also, for an article to be included, it must discuss the strategies used by tobacco, alcohol, or SSB, multinational, transnational industry. So note that if an article discussed food and beverage industry in general, we still read them in full and included these manuscripts if they mention SSB industry specifically. All right, let me go back to the flow chart. Okay, so we screen title abstract and excluded about 5,000. And then we retained about 850A for full text review. So myself and my co-authors read through these articles, and we ended up excluding 799 based on the same inclusion-exclusion criteria I just went over. And then in the end, we included 59 articles. And so questions regarding inclusion were discussed among Mirella, Caitlin, Fernanda, and myself during regular meetings. Okay, now for analysis, we used an initial taxonomy of strategy that was developed by the Johns Hopkins Institute for Global Tobacco Control. The reason why we did this is because of there's a lot in the tobacco control literature. And so through discussion and the experience of experts at IGTC, this figure on your right was developed. So we use that as our kind of initial taxonomy to deductively code the manuscript that we read. And then we also use an inductive process to allow new themes to emerge. And these new themes were discussed amongst the co-authors involved in the charting process. Okay, and now that was the methods, and I'm going to move on to our results. Okay, so I'll start with broad trends. About 50% of the reviews were published between 2019 and 2021, and almost half of them were focused specifically on tobacco industry, 24% on alcohol and 17% on SSB industry, and then 12% on more than one industry. But these trends appear to be changing since 60% of the SSB articles were published between 2020 and 2021. So there seems to be increasing interest in this area. And then multi-industry studies are also becoming more common. 6 out of the 7 multi-industry reviews were published between 2020 and 2021. So also more work on looking across industry in recent years. So of the reviews we included, most of them were systematic reviews, followed by literature review, narrative review, qualitative synthesis, other types of reviews such as rapid review, scoping review, realist review, and mixed methods review. And here is our result table. I'm sorry, this is a little bit small and maybe hard to read, but I'm going to go through each one of them. So let me just give you a brief explanation. On your left-hand side, you'll see the specific strategies that are used by the 3 industries. So there are 6 in total: influencing government policymaking and implementation. And below are some of the specific activities or tactics that fall within that umbrella. The second is challenging unfavorable science. The third is creating a positive image. Fourth is manipulating markets. Fifth, mounting legal challenges. And 6, anticipating future scenarios. And then you'll see the columns show the number of articles. So for tobacco, there was 28. For alcohol, there was 14. SSB 10. Multi-industry 7. And so by 13, you'll see under tobacco and for lobbying 13, that means 13 of the 28 articles mentioned lobbying was used as a strategy by the tobacco industry. So let me go through each one. I'm going to start with the first strategy, influencing government policymaking and implementation. Okay, so also what I've done is I've highlighted or I bolded the specific tactics under the strategy. And then I also highlighted when it's not all 3 industry, just to make it a bit more clear. Okay, so all 3 industries seek to influence government policymaking and implementation to expand corporate autonomy. One of the most commonly cited is lobbying. So lobbying, this means lobbying directly or through the use of third parties. It also includes coalition and constituency building and the use of public-private partnerships. And so in the last case, we found that alcohol and SSB industries have also been privileged with high levels of participation within international public health organizations, which is not seen in the case of tobacco. The second tactic is revolving door. This refers to the back and forth movement of individuals between roles as legislator and regulators and members of the industry affected by legislation and regulation. So for example, moving from the tobacco industry to becoming a parliamentarian, then after not working in the government, working in the industry. So revolving door, and we saw this in with all three industries. Policy capture, we saw this for all three industry as well. So industry captured different branches of government to instigate conflict between ministries and or directly help governments draft legislation. There was also the use of intimidation, incentives, and bribery for all three industries. So this included direct donations or gifts to politicians, policymakers, or political parties. And the purpose was to encourage them to support industry positions or alternatively funding alliances, public health organizations, and friend groups. So one example is the Mexican Federation of Diabetes and Funslaw, for example, sees advocating for health systems reform after receiving funding from Coca-Cola. So more under influencing government policymaking and implementation is influencing voters and the general public. And this is usually done through the strategic use of media. And so, for example, tobacco industry, they pay for advertisement to drum up support for the industry position. And then these advertisements spread the idea that the policy proposed would be harmful to small businesses as well as farmers. We also saw that for alcohol and tobacco industry actors, they develop and promote alternative solutions that have limited or no effectiveness. Okay, so that was influencing government policymaking and implementation. Let's move on to the next strategy, which is challenging unfavorable science. So all three industries challenge science by trying to shape the evidence base. And they do this through, for example, funding research that supports industry favorable results. So in this study, it showed that studies funded by the SSB industry were significantly more likely to find no association between SSB and obesity diabetes than independently funded ones. Several articles also highlight how the tobacco and alcohol industry actors have tried to hide their involvement in research and specifically try to hide their involvement in funding research. And so in this article, it talked about to slow acceptance of the scientific evidence on the dangers of secondhand smoke that were driving legislation and regulation around the world. The transnational tobacco companies secretly recruited scientists and physicians from around the world and funded research without publicly disclosing the source of funding to counter scientific claims against secondhand smoke. And in addition, we saw that tobacco and alcohol industry actors also try to infiltrate the public health scientific community by developing close relationships with scientific bodies and also attending and sponsoring conferences. So that was challenging unfavorable science. Now let's move on to creating a positive image. So all industry actors from all three industries seek to create a positive image of themselves and their products. And they do this through several activities, including corporate social responsibilities activities. So through CSR, they portray themselves as good corporate citizens who are part of the solution. So an example from Philip Morris is the good agricultural practices. There are many, many more. For alcohol industry, so alcohol company, Diageo Responsible Drinking Fund supported prevention programs in over 40 countries. Also many more CSR examples out there. Coca-Cola sponsored more than 150 physical activity programs in more than 100 countries through its active healthy living program. So all three industry actors also have offered voluntary self-regulations. So in this article, industry representatives have reiterated their commitment to combating obesity through measures including sponsoring children's sporting program, providing nutrition and physical activity information, and implementing voluntary self-regulatory codes on advertising to children. So these initiatives, considered acts of corporate social responsibility, are designed to build a positive brand image and to counter public criticism of the industry and its contribution to poor health. These industry actors also engage in issue framing. So all three industry actors, there's evidence to show that they frame their issue as a matter of personal choice as well as individual responsibility. And so the alcohol industry actors, for example, they try to portray the issue of excessive drinking. That's one that is limited to a minority, so binge drinkers, instead of a widespread population level problem. And so this is to the advantage of the industry because it allows them to make arguments against population level policies in favor of individual level policies instead. So all three industries also engage in targeted marketing, including to youth, women, racial and ethnic minority groups. And one of the reasons for the use of this tactic is also to boost the reputation of the industry. And I'm sure many of you have seen these industry actors also create greater variation of products. And the reason for this is to maintain existing users, to attract new ones, and also in some circumstances to demonstrate good corporate citizenship. So this is like healthier, reduce harm products, or in product reformulation, which has been described by some researchers as a regulation avoidance tactic. Okay, so then that was creating a positive image. And now let's move on to manipulating markets. So we found that tobacco and SSB industry actors manipulate costs through pricing strategies. So this includes, for example, price discrimination, price promotion. They also use economic framing to underscore how important they are to the economy of a country, to water down or fight against the adoption and or implementation of population level public health policies. The evidence also show that tobacco and SSB industry actors undermine tax policies by, for example, undershifting, overshifting, or influencing the tax structures of the countries. In terms of tobacco industry actors, the available studies showed that they specifically are involved in illicit trade and smuggling, and tobacco and alcohol industry actors use the potential for an increase in illicit trade, smuggling, as well as black markets, respectively, as arguments against public health policies that would reduce product demand. And then we move on to mounting legal challenges. Okay, so one of the key tactics used under this umbrella is the use and or threat of litigation. So all three industry actors, they threaten to sue in order to frighten or overwhelm opponents, including government opponents. And they try to do this to open up new markets, to undermine national health policy, or to challenge international law. And so from this study, it showed that since the implementation of the SSB tax law, transnational corporations have filed several lawsuits against the Chilean state, challenging the legality of restricting their trademarks, cases which are still pending. These industry actors also use trade agreements and investment laws to challenge national policies. And tobacco industry, evidence show that tobacco industry use economically vulnerable low and middle income countries to serve their interests. So, for example, we saw that LMICs fought against Australia's plain packaging law, as well as Canada's tobacco additive bans in the World Trade Organization Forum with the use of trade arguments. And these arguments were also used to water down Colombia's alcohol health warning label laws. The tobacco industry, and for a long time, used preemption of local tobacco regulations to undermine public health as well. So preemption occurs when higher level of government can limit or eliminate the authority of lower levels of government to enact stronger laws to protect public health. So tobacco industry actors have used this as one of their key strategies. And finally, the last set of strategies that are used, anticipating future scenarios. And so in recent years, the industry actors from all three industries have been expanding into emerging markets. The reason for this is to counteract the declining sales in high-income country. So for example, British American Tobacco, Imperial Tobacco, Philip Morris International, and etc. They started targeting Southeast Asian markets soon after tobacco consumption started to decline in high-income countries. We also found studies to show that tobacco and SSB industry actors monitor and also discredit public health proponents in order to come up with counter strategies in anticipation of future scenarios that may jeopardize their corporate autonomy. Okay, so that was the results from this study. I'm now going to move on to discussion. Okay, so as you've seen, there are 6 main strategies that all three industries use. And as mentioned before, this includes influencing government policymaking and implementation, challenging unfavorable science, creating a positive image, manipulating markets, mounting legal challenges, and anticipating future scenarios. So these findings are consistent with existing work. The limited number of studies that currently exist that looks across industry. They've also showed that these unhealthy commodity industries use a similar playbook to undermine public health. So this is very consistent. And there's many reasons that this is taking place. And some of the reasons are the various ways in which these three industries are linked. So for example, studies have shown that tobacco and alcohol companies have direct partnerships and share information and strategies with each other. Other articles, for example, show that some of the SSB companies are also produce alcohol products. And the third-party facilitators of these industries, such as public relation firms or marketing firms, have been employed by, say, tobacco industry and alcohol, as well as SSB, for example. So they've been employed by the different industries, the same third-party facilitators. So that's some of the reason why that these industries are using a similar playbook. Even though our findings showed that the tactics used are majority of them are similar, there's also few but important differences. And so one of the key differences we found is that the alcohol and SSB industries have been privileged with high levels of participation within international public health organizations. This is really different from what has happened to the tobacco industry. So as many of you know, FCTC through Article 5.3 and mandates parties of the treaty to protect tobacco control from vested interests and to also limit the interaction with the industry. So the reason for this high-level participation for alcohol in the SSB industry, some speculate, is that this could be in part due to the fact that some non-industry actors hope that this type of partnership could result in industry-initiated changes, such as the reformulation of their unhealthy products. Other differences, so developing, promoting alternative solutions, infiltrating the public health scientific community, hiding industry role in research, the use of illicit trade and smuggling, and trade framing, so all these were seen primarily in the case of tobacco and alcohol, and not so much the SSB industry. There's some reason for this. There are fewer reviews, so we only have 10 reviews of SSB industry strategies. And also the other reason could be that the evidence surrounding the health harms of SSB only started accumulating in recent years. So some of the interventions, such as raising taxes on SSB products, are relatively new in many countries compared to tobacco and alcohol. Another difference is that even though there are systematic reviews on the health effects of alcohol taxes, we did not find any reviews that discuss the alcohol industry undermining tax policies as we did for tobacco and SSB industries. Just highlight here reviews. So this is likely due to the fact that 14 of these reviews were included, and these were the only 14 reviews we found that explored alcohol industry strategies. So what are some implications from this study? So given that the three industry really uses similar strategies, and that public-private partnership at the national or international levels are not backed by strong evidence of their effectiveness, and also the health burden posed by consuming tobacco, alcohol, and SSB products, some experts in this area have strongly argued that the measures used for tobacco really should be applied to these other industries, so the alcohol and SSB industries as well. Unfortunately, the public health community seems to continue to disagree about the ethical terms of engagement or non-engagement with unhealthy commodity industries. And this is a really concerning problem because as we see from political science literature, for example, policy change occurs when there's cohesion amongst those, say, public health proponents. And without this type of cohesion, it could limit the public health movement. So there really is an urgent need for the public health community to come to consensus about not just how to limit corporate autonomy in industries that harm health, but also developing guidelines, I think, for government, for scientists, on how to ethically engage or not to engage with these unhealthy commodities industries. Thirdly, the results show that all three industries have been trying to expand their reach in emerging markets as their sales decline in high-income countries. And we also know that NCDs, most of the deaths occur in LMICs. So there really is an urgent need to raise awareness in these settings of the tactics that are used by these industries, share the lessons learned, and also to increase the capacity of public health advocates in these settings to counter industry interference. Of course, this study has limitations. So the first, I've mentioned this before, to ensure that this study was manageable, we only included review articles. And so as a result, some of the strategies may have been missed. And the second limitation is that we focus specifically on SSB industry rather than the bigger food and beverage industry. This is also to ensure that the study was manageable, but we tried to limit this, minimize this limitation So if we do come across a food and beverage industry papers from our search, we did review it in full and included ones that did discuss SSB industry tactics specifically. And then third, our findings reflect the limitations of existing literature. So some of the types of industry, so some of the industry involvement are behind the scenes, and it's really challenging to capture and observe. And so our study was only able to capture what it was accessible, and what was available in the peer-reviewed literature that we included. And then finally, only English review articles were included. So we didn't include articles that were in other languages. I think, so for future studies, I think more comparative studies are needed to explore the similarities and differences across other industries too. So looking at how perhaps tobacco, alcohol, motor vehicle, pharmaceutical, SSB industries share similar or different strategies, coal, oil, and gas. So doing more comparative studies, looking across industry. I think that is much needed. I think it'll also be important for future studies to explore the strategies used by public health advocates to overcome industry interference. There's a lot more on industry strategies and not as much on strategies used by public health advocates. I think these would be very useful. So one example would be doing comparative case studies to explore how public health advocates in different settings overcome industry interference, or did they use similar strategies, which ones seem to be more effective. And another would be having tools to help assess the level of industry interference and government's effort to protect public health from vested interests. So I know within the area of tobacco control, the Tobacco Industry Interference Index exists. But for other industries, we haven't come across tools, and those would be really useful as well. So in conclusion, our studies showed that the tobacco, alcohol, and SSB industries utilize similar strategies to expand corporate autonomy. And even though most of the strategies were similar, there were also some important differences. And this could be explained by the different approaches that the public health community has been using towards these industries, as well as the limited number of reviews that explore alcohol and SSB industry tactics. As mentioned, there's an urgent need for public health community to generate consensus, develop guidelines on how to engage or not engage with these industries, and to limit corporate autonomy of these industries that harm health. And then finally, given the escalating burden of NCDs in LMICs, there's really an urgent need to bolster the capacity of public health advocates in those countries to counter interference, increase awareness of industry tactics, and also to develop the evidence base of alcohol and SSB industry tactics. So I would like to acknowledge, well, first thank Bloomberg Philanthropies, Bloomberg Initiative to Reduce Tobacco Use for funding this study. And also a very, very special thanks to my amazing co-authors who contributed so much to the study. Could not have been possible without them, Caitlin, Marilla, Fernanda, Adam, and Joanna. If you're interested in reading more about the study, it's available online, open access, and you can just Google the name of this talk, and you should be able to come across this article. It's in Globalization and Health. So thank you so much, and I'll pause here for questions.
Wonderful. Thank you so much, Connie. I mean, this is such important work, and this represents a tremendous amount of work. I mean, just hearing, screening thousands of articles and reading, over 800 articles, that's quite something. I'll ask you to stop sharing your screen, and for folks to add any questions into the Q&A chat. And as we're collecting some questions, I just wanted to mention that even even in tobacco, unfortunately, in the academic community, there's still not 100% consensus on interactions with the tobacco industry. And I know one of our own scientific societies, the Society for Research on Nicotine and Tobacco, recently implemented a policy to disallow tobacco industry employees from being at the conference. And there was a lot of backlash and enough, people unhappy, some unhappy people, others were very happy, but there's still, I think we still have a ways to go. But clearly there's been a lot more discussion about these issues in the tobacco sort of area compared to some of the others. So I'm going to jump into some of the questions that have come in. So first one from Steve Tamplin. Were you able to reach any conclusions, or do you have any thoughts about the relative effectiveness of particular industry tactics in particular countries, so specific to particular countries? Did anything come through?
So great question. We did not explore that. However, from this study, as well as some of the case studies that we've done, we see that industry utilizes an array of tactics and kind of use it from different angles to get their final results. So I would say, just from these experiences and reading the articles that we've screened, that it's more than one tactic that they use. They use multiple together. So it's a little bit difficult to judge which one is most effective, I would say. But that could be a future research. It would be a very interesting topic.
Great. Next question we have. So thanking you for your presentation and your work. And then a two-part question. One is, can you triangulate these findings with other research methods? And if so, what might those be? So you did a scoping review, but are there other ways to look at these tactics? I know you've actually led some of those other approaches, but maybe you can speak about that briefly. And then also, this person's curious as to whether you found or know of any countries that have already implemented comprehensive policies to counter or limit corporate autonomy of these industries.
So great questions as well. So in terms of other methods that could complement this, and as Joanna mentioned, or some of the work that we've done too, is using case study approaches. So really looking at, for example, the passage of a tobacco tax policy, for example, and interviewing key informants who were intimately involved in the policymaking process to get an understanding of what the industry actors used as tactics to oppose and water down these policies. And also at the same time, trying to understand the tactics that the public health proponents use to actually get these policies passed. I think thinking about cross-industry studies, it would be really fascinating to find a country where you see, say, three, so one tobacco control policy that's passed, one alcohol control policy passed, SSB policy, say SSB tax that's passed, and then interview these key informants to get an understanding of the similarities and differences these industries use through this process. So you can directly compare that. It would be, a great study to do, I would say. Yeah. And in terms of the second question, countries that have utilized approaches to limit corporate autonomy, I think countries that have implemented maybe perhaps the FCTC Article 5.3 well, that would be countries that would serve as good examples on how they limit corporate autonomy. So that could be one way of looking at it. There's also another study, another scoping review that looked at the different mechanisms that governments have used or can use to kind of to basically limit corporate autonomy. It doesn't specify specific countries, but it does detail the specific tactics that's been used, the specific strategies that's been used. And this is a paper by Melissa Milan that I would encourage you to take a look at.
Super, thanks so much. And I know you have some work from the Philippines too that looked at both the passage of tobacco and alcohol provisions, and particularly with respect to taxes. So it's fascinating when these things are happening in concert. I'll move on. We have a few questions, so we'll try and get through these remaining ones. Do you have thoughts on what can be done to counter the positive images that industries try to create through the strategies that you laid out? And then at the same time, how do we push them to make real changes?
So I think to counter these positive images that corporations are kind of trying to send out is by really exposing this as an industry tactic. Because many times when people who are not in this field, they think corporate social responsibility that these health harming industries are doing are really great. It really, just give them more legitimacy and allow them to use it as a marketing tactic. And so I think really to shed light, because so many people are not aware, to really expose what these industries are doing would be a really critical first step in helping to counter that. And then the second question, sorry, just I forgot what it was.
No, I think, yeah, so how to counter it and make sure that there's real change. Like, with corporate social responsibility, they're trying to sort of imply that they're changing and they're good corporate citizens, and on balance, they have much more sort of positive impacts than negative. So any thoughts on ensuring that real change is made?
Yeah, good question. I would say, just from my perspective, I think this is a really tough one. Holding them accountable and really documenting and making sure that there's evidence to show that they actually make these changes. I think many times there, isn't, because they're not. So yeah, that's a bit of a tough question.
It is, and we see, I guess, like a tobacco company in England saying, they have a plan to stop selling cigarettes. But at the same time, of course, they're marketing them heavily in other countries. So I think, exactly as you say, you have to, at the very least, point out these inconsistencies. Maybe we'll try a couple more questions. So from Ryan, some people argue that public health should use some of the same tactics that these industries are using. And do you think we should do that, or is it more important to maintain the high ground?
Interesting. Curious to know what you mean by that, because we do see public health advocates doing lobbying as well. So they talk to politicians to make sure that they understand the evidence base surrounding a public health policy. They also engage in media advocacy like the way the industry does as well. So there are similar tactics that the public health advocates have used. So curious to know what you mean by the other ones to maintain a higher ground.
Yeah, I guess, no, I think that makes sense. I think already, I guess they are effective strategy, or they can have impact. And so that's important. And I guess some of the tactics maybe aren't as applicable for public health, like some of the economics tactics.
Right, yeah.
But yeah, thanks for addressing that. And I think also you know, people are saying, well, okay, what can we do about it? So another question about how to sort of prevent or keep in check the surrogate advertising that industries do.
Yeah. Yeah, very hard. I think one of the key steps I would still say is increase awareness. I think this is much needed. Yeah, and make sure that people are aware that industry are using these as tactics to undermine public health.
Right, just shedding light.
Yes.
And I think maybe this, unfortunately, is going to have to be the last question, but we'll share the remaining questions with Dr. Hoe, and maybe we can follow up. Afterwards. I'm sorry. So the last question, again, a thank you for the amazing amount of work and the contribution to the evidence base. And so in some countries, there's a push to increase taxes across tobacco, alcohol, and sugar-sweetened beverages. So from a public health perspective, this does seem like a good strategy to leverage policy conversations across ministries and advocacy groups. However, based on your work, do you have any thoughts about how we should strategically think about industry response in these cases when we're trying to sort of do it all in one fell swoop, and then any potential collaboration on opposition to a tax increase?
I think this is a great question, and actually something we encountered when we were doing our case study in the Philippines. And so they were trying to pass a tax on both tobacco and alcohol products at the same time. And the biggest concern was the industry kind of teaming up to oppose the tax. And so the recommendations have been to tackle one unhealthy product at a time, so that you don't run into the issue, or not one unhealthy product, but to tackle one industry at a time, so you don't run into the issue of these industry actors teaming up and really opposing the tax. And so in the Philippines, unfortunately, even though there was a tax increase on alcohol, it wasn't as high because they were trying to appease the alcohol industry actors in order to pass the tobacco tax. And that's why I think maybe that's something that needs more study in the area, and also something to take into consideration. And then just to add to the previous, I think, yes, shedding light is important, but also, as I mentioned in the talk too, I think having guidelines for scientists, for government, on how to engage or not engage with these industries is also really important, to generate consensus amongst the public health community, and also really to consider these global treaties for regulating these unhealthy commodity industries will also be really critical. Yeah.
That's great. And as you mentioned, I mean, having the tobacco industry interference index is really helpful to, again, keep the conversation going, keep assessing, having data. Yes. To demonstrate what's happening. Mm-hmm. So unfortunately, we're going to have to leave it there. We've got the remaining questions are all excellent, so we'll make sure to answer those. But please join me in giving a big thank you to Dr. Connie Hoe and her team for a terrific work and a wonderful presentation. Thank you so much.
Thank you so much for having me. Take care, everyone.